committee, there were about 15 of us who met every week, and then a smaller group of us. And Tom Marcella, our medical director, who was working his butt off as a doctor, a country doctor, that was his day job. But he was just working nights and weekends trying to figure out how to envision this new organization. And we finally got some help from other volunteers and, you know, legal assistants to figure out how to write up articles of incorporation and how to launch this thing, which became the Northwest AIDS Foundation. I was on the founding board. I pulled back shortly after that because I felt I was neglecting my work at public health. And also, my partner was sick, and I was really worried that he was dying, so I had to kind of pick and choose what I was going to do at that point. So Tom went on to become the first director of the Northwest AIDS Foundation, just for a short time. He eventually left and went to medical practice in California. Bob Wood then became the director of the Northwest AIDS Foundation. Bob had been a physician at Pacific Medical Center and the Public Health Service before that. He was also one of the volunteer docs at Seattle Gay Clinic. So he first volunteered to be on this committee, and then he became the director of the board of the Northwest AIDS Foundation after Tom left. Bob, a few years later, became the director of the AIDS program, the medical director of the AIDS program at Public Health, where I worked, and he did that until 4 years ago when he retired. So again, many of these people who were key pioneers and volunteers and leaders in the early years stayed and became mainstays in the larger county-wide, national, if you will, response to HIV and AIDS.